Maintaining a healthy diet is one of the most important aspects of aging gracefully, and fruits are often considered a cornerstone of a nutritious meal plan. Packed with vitamins, minerals, and antioxidants, fruits offer numerous benefits, such as supporting heart health, improving digestion, and boosting the immune system. However, not all fruits are created equal, especially for seniors. While many fruits can be beneficial, certain varieties may pose hidden risks that are particularly dangerous for older adults. As the body ages, it undergoes several changes that can make it more sensitive to certain foods. Seniors often experience health conditions like diabetes, kidney issues, or compromised immunity, which can be exacerbated by seemingly harmless dietary choices. For example, some fruits can interfere with medications, trigger allergic reactions, or lead to serious digestive problems. Understanding these risks is crucial in avoiding potential health complications. In this video, we'll reveal 6 fruits that seniors should avoid due to their dangerous side effects. But before we move on, if you're enjoying this content, please take a moment to like, comment, and share it with your friends. Doing so helps more people discover the channel. This content is for informational purposes only and should not be considered medical advice. Always consult a healthcare professional or registered dietitian for personalized dietary recommendations. Now, let's explore the 6 dangerous fruits seniors should never eat. Grapes are a beloved fruit, often enjoyed fresh or as part of dried snacks, juices, and wines. Packed with antioxidants, vitamins, and fiber, they are typically seen as a healthy snack option. However, for seniors, grapes can present some significant health risks that may not be immediately apparent. One of the primary concerns with grapes for older adults is their high sugar content. Grapes, particularly in their dried form, are concentrated sources of glucose and fructose, 2 simple sugars that can lead to blood sugar spikes. For seniors living with diabetes or those managing prediabetes, consuming grapes without caution can cause rapid blood sugar fluctuations, making blood sugar control more difficult. Maintaining stable blood glucose levels is critical for seniors to avoid complications such as neuropathy, cardiovascular disease, and kidney issues, which are more common with uncontrolled diabetes. Moreover, grapes, especially when consumed in large quantities, can present a choking hazard. This is a serious consideration for seniors with swallowing difficulties, a condition that affects many older adults. Choking risk increases with fruits that are small, round, and slippery like grapes, which can become lodged in the throat. Seniors with weak jaw muscles, reduced saliva production, or neurological conditions such as Parkinson's disease may find it more difficult to chew or swallow grapes safely. Seniors with kidney problems should exercise caution when consuming grapes. Grapes are rich in potassium, and while potassium is an essential nutrient, an excess can lead to hyperkalemia, a condition where potassium builds up in the bloodstream. The kidneys, which are responsible for filtering out excess potassium, may struggle to do so effectively in individuals with kidney disease. This can result in dangerously high potassium levels, leading to arrhythmia, irregular heartbeats, muscle weakness, and even life-threatening complications. Oranges are widely regarded as a healthy and refreshing fruit, bursting with vitamin C and other essential nutrients. However, for seniors, consuming oranges might not always be the best choice. While oranges offer numerous health benefits, their high acidity and potential interactions with medications can pose significant risks. One of the most common health issues associated with oranges in older adults is their high acidity. The acidic nature of oranges can worsen symptoms of acid reflux or gastroesophageal reflux disease, conditions that become more prevalent with age. Gastroesophageal reflux disease occurs when stomach acid flows back into the esophagus, causing heartburn, regurgitation, and discomfort. For seniors already suffering from gastroesophageal reflux disease, consuming acidic foods like oranges can exacerbate these symptoms, leading to frequent discomfort and, over time, damage to the esophagus lining. Additionally, the burning sensation associated with acid reflux can significantly diminish a senior's quality of life and may also disrupt sleep, contributing to fatigue and irritability. Oranges are also a fruit with a relatively high potassium content, which can pose risks for seniors with kidney disease. The kidneys are responsible for regulating the amount of potassium in the blood, and when they are not functioning properly, excess potassium can build up. This condition, known as hyperkalemia, can lead to serious complications, including irregular heart rhythms and muscle weakness. Seniors with kidney disease or impaired renal function should avoid high potassium foods like oranges unless specifically advised by their healthcare provider. Oranges also pose a risk to oral health. The citric acid in oranges can erode tooth enamel over time, leading to tooth sensitivity and decay. For seniors, this is a particularly concerning issue, as they may already be dealing with dental problems, such as gum disease or tooth loss. Over time, acidic foods can weaken the enamel, making teeth more vulnerable to cavities. Seniors should consider consuming oranges in moderation and may want to rinse their mouths with water after eating to minimize the risk of enamel erosion. One of the primary issues with avocados for seniors is their high fat content. Avocados are rich in monounsaturated fats, which are considered heart-healthy fats, but they are still calorie-dense. For seniors who are already struggling with weight management, consuming avocados in large quantities can contribute to unwanted weight gain. Excess body weight can place added strain on joints, increase the risk of heart disease, and complicate existing health conditions such as diabetes or hypertension. Seniors should be mindful of portion sizes when consuming avocados to ensure they are not consuming too many calories, which could interfere with their overall health goals. Although avocados are generally well tolerated, they may also pose an allergenic risk for some seniors. Allergies to avocados are relatively rare, but they can occur, particularly in individuals who are sensitive to latex. The proteins found in avocados share similarities with those found in latex, which can trigger a reaction in susceptible individuals. Symptoms of an avocado allergy may include itching or swelling in the mouth, throat, or lips, as well as gastrointestinal discomfort. In some cases, more severe allergic reactions, such as difficulty breathing or anaphylaxis, can occur. Seniors who have known latex allergies should exercise caution when consuming avocados, as the risk of an allergic reaction may be higher. Avocados may not be the best choice for seniors with digestive issues. The high fat and fiber content in avocados can sometimes lead to digestive discomfort, including bloating, gas, or diarrhea. Seniors with sensitive digestive systems or conditions such as irritable bowel syndrome, IBS, may find that avocados worsen their symptoms. The fiber in avocados can also be difficult for some seniors to process, leading to gastrointestinal upset. For those with compromised digestive health, it may be necessary to limit avocado consumption or choose other fruits that are easier to digest. Watermelon is often seen as a refreshing and hydrating fruit, especially during the hot summer months. With its high water content, watermelon is an excellent source of hydration, and it also contains beneficial vitamins and antioxidants like vitamin C and lycopene. However, for seniors, watermelon can present a few health risks that should not be overlooked. One of the primary concerns with watermelon is its high glycemic index, GI. The glycemic index measures how quickly a food raises blood sugar levels after consumption. Foods with a high GI cause rapid spikes in blood glucose, which can be problematic for seniors with diabetes or those at risk of developing the condition. While watermelon is not as high on the glycemic index as some other fruits, it is still considered a high GI food. This means that consuming watermelon in large quantities can lead to a rapid increase in blood sugar levels, making blood sugar management more difficult for seniors with diabetes. Seniors should be cautious with their portion sizes to avoid blood sugar spikes, especially if they are managing diabetes. Another issue with watermelon is its potential to cause bloating and fluid retention, particularly in seniors with heart conditions or kidney issues. Watermelon is high in water content, and while this is typically beneficial for hydration, it can cause fluid retention in individuals who have difficulty excreting excess fluids. Seniors with conditions like congestive heart failure or chronic kidney disease may find that consuming large amounts of watermelon exacerbates symptoms like swelling, shortness of breath, and discomfort. It's essential for these individuals to be mindful of their fluid intake and avoid over-consuming water-rich fruits like watermelon. Additionally, watermelon can sometimes cause digestive discomfort. While the fruit is rich in fiber, which is beneficial for digestive health, consuming too much can lead to bloating, gas, or diarrhea. Seniors with sensitive digestive systems, or those with conditions like irritable bowel syndrome, IBS, may find that watermelon aggravates their symptoms. The high water and fiber content can overwhelm the digestive tract, leading to discomfort and disruption of normal bowel movements. One of the most notable concerns with papayas for seniors is the presence of papain, an enzyme found in the fruit that aids in digestion by breaking down proteins. While papain is beneficial for digestion, it can cause problems for some individuals, especially those with sensitive stomachs or digestive disorders. In rare cases, papaya can lead to allergic reactions, with symptoms ranging from mild irritation to severe anaphylaxis. Seniors who have latex allergies should be particularly cautious, as papayas contain proteins that are similar to those in latex, which can trigger an allergic response. The symptoms of a papaya allergy may include swelling, itching, rash, or difficulty breathing. If a senior experiences any allergic reactions after consuming papaya, they should seek medical attention immediately. Papayas also contain high levels of vitamin C, which is generally beneficial for the immune system, but can become problematic if consumed in excess. Too much vitamin C can cause gastrointestinal distress, including diarrhea, stomach cramps, and nausea. Seniors with sensitive digestive systems or those with a history of gastrointestinal issues should be cautious when consuming large quantities of papaya, as the high vitamin C content can exacerbate these conditions. Additionally, papayas are a source of folate, which is crucial for cell health and the formation of red blood cells. However, excessive folate intake can interfere with the absorption of other nutrients, potentially leading to imbalances in the body. Seniors who take supplements or have specific nutrient needs should speak with their healthcare provider before consuming large amounts of papayas. Papayas also contain a substantial amount of fiber, which is beneficial for digestive health, but may cause discomfort in seniors with existing gastrointestinal conditions. The high fiber content can cause bloating, gas, or diarrhea, particularly in individuals with conditions such as irritable bowel syndrome through IBS or diverticulitis. Seniors who are sensitive to fiber should consume papayas in moderation and monitor how their digestive system responds to the fruit. Star fruit, also known as carambola, is a tropical fruit that is known for its distinct star-shaped cross-section and refreshing, slightly tangy flavor. While star fruit is a delightful treat for many, it poses serious risks to seniors, particularly those with kidney problems. One of the most dangerous concerns related to star fruit is its potential to cause toxicity in individuals with kidney disease. Star fruit contains a neurotoxin called chromboxin, which can be harmful when consumed by individuals with compromised kidney function. The kidneys play a vital role in filtering out toxins from the body, and when they are not working effectively, substances like chromboxin can accumulate in the bloodstream, leading to toxicity. Symptoms of star fruit poisoning can include confusion, agitation, seizures, and even coma in severe cases. For seniors with kidney disease or those on dialysis, the consumption of star fruit should be avoided, as their kidneys are unable to filter out the harmful compounds present in this fruit. Even in individuals without kidney problems, starfruit can cause adverse reactions. The neurotoxin in starfruit can affect the central nervous system, leading to symptoms such as dizziness, headaches, and muscle weakness. These effects can be particularly dangerous for seniors who are already at risk for falls and balance issues. The risk of these neurological symptoms may be increased for older adults who are taking medications that impact the nervous system or those with pre-existing neurological conditions such as Alzheimer's disease or Parkinson's disease. Another concern with starfruit is its high oxalate content. Oxalates are naturally occurring compounds found in many fruits, vegetables, and other plant-based foods. In high amounts, oxalates can contribute to the formation of kidney stones. Seniors who are prone to kidney stones or have a history of calcium oxalate stones should avoid starfruit to reduce the risk of stone formation. The high oxalate content in starfruit may also pose a threat to seniors with calcium absorption issues, as oxalates can bind to calcium in the digestive tract, preventing its absorption and potentially leading to calcium deficiencies. As we've seen throughout this video, many commonly consumed fruits can pose hidden health risks for seniors. While fruits are an essential part of a healthy diet, seniors must consider factors such as sugar content, acidity, potential interactions with medications, and digestive health when selecting fruits for their meals. The risks associated with certain fruits can vary significantly depending on an individual's health status, including pre-existing conditions like diabetes, heart disease, kidney issues, and digestive disorders. Therefore, seniors should always consult with their healthcare provider or a registered dietitian to determine the best dietary choices for their specific needs. By being mindful of these potential health risks, seniors can make informed decisions that will help them maintain a balanced, nutritious, and safe diet as they age.